Good afternoon, everyone. Today I'm going to talk to you about the arteries and veins, or the vascular system. I am sharing my screen of PowerPoint, so hopefully you'll be able to go along with this. So the vascular system, there's some definitions at the beginning. The vascular system consists of an arterial blood supply, a capillary network, and venous drainage. There's something called a vascular plexus, which is a large network of blood vessels, and anastomosis is a connecting channel among those vessels. An artery arises from the heart and carries blood away from it. Artery away. So arteries carry blood away from the heart. Each artery starts as a large vessel and branches into smaller arterioles. Capillaries, each arteriole branches into even smaller vessels, which are called capillaries. So you've got the artery, you've got an arteriole, and then you've got capillaries coming off of that, and they carry blood away from the heart. A vein carries blood to the heart. So after each smaller vein or venule drains the capillaries of the tissue area, the venules, or the small veins, coalesce to become larger veins. So arteries start out big and then they break down to smaller little branches like a tree, and the veins are like opposite of the tree. They start out as small little branches and pull together into the bigger, larger trunk. Venous sinuses are blood-filled spaces between two layers of tissue, and all these venous networks are connected by anastomosis. Anastomosis is the way they communicate. Dental professionals must be able to locate the larger blood vessels of the head and neck because these vessels may become compromised due to pathologic processes, such as when you're administering local anesthesia. And blood vessels can spread dental infections. So bacteria from a dental infection can travel through the bloodstream and carry that bacteria and that infection to other parts of the body. Arterial blood supply to the head and neck. So there are two major arteries that supply the head and neck, and those are the common carotid and subclavian. The origins from the heart of the head to the head and neck of these two major arteries are different depending on which side of the body. So on the left side, the common carotid and subclavian arteries arise directly from the aorta. On the right side, the common carotid and subclavian are both branches from the brachiocephalic artery. There's a picture there on this slide showing the different arteries and the way that they branch off of each other. Put this on a slideshow so we have a little bit bigger of a picture here. Okay. The common carotid artery is branchless and travels superiorly along the neck. So it runs up superior toward the head. The common carotid travels in the carotid sheath deep to the sternocleidomastoid muscle. So if you remember from your directions, deep would be underneath or closer to the midline. The sternocleidomastoid muscle would run basically over it. The carotid sheath also contains the internal jugular vein and the 10th cranial or vagus nerve. The common carotid artery ends by dividing into the internal and external. So it runs up along the side of the neck toward the head, and then it branches into the internal and external carotid arteries. Just before it bifurcates is the carotid sinus. So when you put your fingers on somebody's neck and you're feeling for a pulse, you're feeling for the carotid pulse. So you're feeling that carotid sinus right here in the neck. The internal carotid artery travels superiorly in a slightly lateral position in relation to the external. So lateral would be closer to the side. So the internal travels slightly lateral to the external. It has no branches in the head and neck, so we don't really pay a lot of attention. The one that we're going to study the most is going to be the external. The external carotid artery travels superiorly in a more medial position in relationship to the internal carotid. So medial, it sounds kind of opposite of what their names are. The external is actually more closer to the inside or medially positioned. The internal is actually more lateral positioned. It has 4 sets of branches grouped according to their location to the main artery. So you have an anterior branch, a medial, a posterior, and then the terminal branches or end branches. Your anterior branches of the external carotid artery, there's 3 of those. And so this little diagram here in figure 6.4 came right out of your textbook, and I kind of made darker rectangles around the bigger branches. We have the facial artery, the lingual artery, and the superior thyroid artery. And they are kind of, if you think of them as they're stacked like they are, the facial would be up here, the lingual would be closer to your mouth, and the superior thyroid would be right in the thyroid area. An anterior branch from the external carotid, the superior thyroid artery has 4 branches: infrahyoid, sternocleidomastoid, superior laryngeal, and cricothyroid. And so I highlighted those on this picture on figure 6.3. These are right out of the textbook, so if you want to go back and when you're reading the chapter and kind of refer to them, the black circle in the center is the hyoid bone. So the superior thyroid and the thyroid are below the hyoid bone. And of course, superior thyroid would be above the thyroid gland, superior to, and it supplied the structures inferior to the hyoid bone. So they would supply these structures between the thyroid gland and the hyoid bone. And you can see I put an arrow there. It shows you the artery right there. The lingual artery is an anterior branch from the external carotid that has 3 smaller branches as well: the suprahyoid, the dorsal lingual, and the sublingual. So suprahyoid would be above the hyoid bone. The dorsal lingual would be in the tongue area, and then the sublingual would be under the tongue. And so I've marked those branches. I've circled the hyoid bone so you can kind of see the superior thyroid, and then you've got the lingual artery. The lingual artery supplies the suprahyoid muscles, the floor of the mouth, the tongue, the lingual tonsils, and the soft palate. So think about what's right around the tongue area, lingual being tongue. You've got your suprahyoid muscles. Your suprahyoid muscles, like your mylohyoid, run along the floor of the mouth. And then you've also got the floor of the mouth, the tongue. The lingual tonsils, remember, sit on the back of your tongue. And then your soft palate is right about in the middle where you swallow. So it's just kind of this whole area right in here. The tongue is also supplied by branches of the lingual artery, including several small dorsal lingual arteries to the posterior dorsal surface, as well as deep lingual artery, the terminal part of the lingual artery from the ventral surface to the apex. So basically the lingual artery also supplies the tongue. Sublingual artery supplies the sublingual salivary gland. Your sublingual salivary gland sits right underneath your tongue, right in this area. So sublingual, right under the tongue. The oral mucosa of the floor of the mouth. So just that like soft area that you're going to kind of palpate when you're doing your intraoral exam. And then your lingual, periodontium, and gingiva of the mandibular teeth. So these areas right inside the teeth here. Lingual, periodontium, and gingiva of the mandibular teeth. The facial artery is the final anterior branch from the external carotid artery. It arises slightly superior to the lingual artery as it branches off anteriorly and terminates at the medial canthus of the eye. So if we were to trace the facial artery, We can see it starts over here and it travels along and then it goes up slightly and it ends all the way here in the medial canthus of the eye. So just trace that artery right there. And then your other two arteries, you've got your lingual artery, and you can see it's coming along and it's going to supply under the tongue. And then you've got your superior thyroid artery, which comes down. So if you wanted to try and memorize them, I would try to memorize them just alphabetically. Your facial is the highest one, your lingual one is in the middle, and your superior thyroid drops downward to the thyroid gland. Your facial artery supplies the face in the oral, buccal, zygomatic, nasal, infraoral, and infraorbital and orbital regions. And I've circled these areas here. These are your facial, the branches of your facial artery. You have your major branches, and here is a mnemonic. A tough, strong guy is a super athlete. A, ascending palatine, tonsillar branches, submental artery, glandular branches, inferior labial, superior labial, and angular artery. And I've marked all of those here for you, but if you can remember this mnemonic all falls under the facial artery, that would probably help you a lot. And if you want to come up with your own mnemonics so that you have a better way of remembering it and not trying to memorize mine, that's totally fine too. Your ascending palatine artery supplies the soft palate and the palatine muscles. And your tonsillar branches also the palatine tonsils. So we are in the soft palate and those like kind of archways there where the palatine tonsils sit. Your submental artery supplies the submandibular lymph nodes and the mylohyoid and digastric muscles. Your glandular branches supply the submandibular salivary gland. Your inferior labial artery, so now we're going to kind of be describing by location. Inferior would be lower, labial lip. So your inferior labial artery supplies the lower lip area. Your superior labial artery supplies the upper superior. And your angular artery is the terminal branch of the facial artery and supplies the lateral side of the nares of the nose. So just kind of think right in here, the angles. There's only the medial branch of the external carotid artery. There's only one medial branch from the external carotid artery, the small ascending pharyngeal artery that arises close to the origin of the external carotid. Now the posterior branches of the external carotid artery. There are two posterior branches of the external carotid. We have your occipital and your posterior auricular. So if you think of the carotid artery to the posterior, your anterior is going to be toward your face, posterior is going to go back. So if it goes back, you've got your occipital and posterior auricular. Your auricle is your ear. So posterior auricular would be behind or the posterior of the ear area. So it's just these two areas right here. Your occipital artery travels to the posterior scalp and supplies the suprahyoid muscles, the sternocleidomastoid muscles, and the auricular region, meninges, and trapezius. And your posterior auricular supplies the inner ear and the mastoid cells. Then you've got your terminal branches of your external carotid artery. You've got two of them, the superficial temporal maxillary, superficial temporal and maxillary. The external carotid artery splits into these terminal branches within the parotid salivary gland. So it runs along here. Your parotid gland is right here in your cheek area, and it splits. And so your superficial, which would be close to the skin, superficial temporal is going to run up here to the temple, and your maxillary is going to come this way to the maxillary. Your superficial temporal artery then has smaller branches to it. You have the frontal branch, the middle temporal, the transverse facial, and the parietal branch. And they are going to supply areas on the sides of your head. Small transverse facial artery supplies the parotid salivary gland and duct and nearby facial area. The equally small middle temporal artery supplies the temporalis muscle. The frontal branch and parietal branches both supply parts of the scalp in the frontal and parietal regions respectively. I have designed this little spreadsheet and it's posted up on Canvas that you can use to kind of track what breaks into what. There are a lot of arteries and a lot of branches, so we'll try to just kind of think of them like the trees where you've got all the branches coming off and then all these little branches, and try to memorize them that way. This is where your mnemonics are going to come in handy. Try not to spend a lot of time memorizing the ones that sound like their names. Spend a little bit more time on the ones that don't tell you their location. The maxillary artery is the largest terminal branch of the external carotid. It courses between the muscles of mastication and ascends toward and enters the pterygopalatine fossa. The course of the maxillary artery has 3 parts designated by location, so thankfully they made this easier for us. The mandibular part of the maxillary artery, the pterygoid part of the maxillary artery, and the pterygopalatine part. And so on this slide 34, I have shown you the divisions of the maxillary artery. The first part, it has branches in the deep auricular artery, supplies the auricular region and the outer tympanic membrane. So the deep auricular artery, think of your auricle or your ear. And then you've got the anterior tympanic, which supplies your tympanic membrane. Your middle meningeal supplies part of the brain, and your accessory meningeal supplies the other parts of your brain. And then your inferior alveolar artery arises from the first part in the infratemporal fossa, supplies your mandibular teeth, the buccal labial periodontium, gingiva, mental region, floor of the mouth, and mylohyoid. So the main one you want to remember on the maxillary artery first part is the inferior alveolar artery. That's the one we really care about. It supplies your teeth, your gingiva, your mental region, floor of the mouth, and the mylohyoid muscle, which helps to form the floor of your mouth. The inferior alveolar artery also arises from the maxillary artery in the infratemporal fossa. It enters the mandibular canal through the mandibular foramen. This picture here is in your textbook. You are going to have to trace some of the main branches of these arteries. The mental artery exits the mandibular canal by way of the mental foramen. You remember the mental foramen is located at the apex of, approximately at the apex of the second premolar, along with the mental nerve. So this chapter and the nerves, chapter 8, they kind of run simultaneous because arteries and nerves kind of track each other in many places. The incisive artery branches off the inferior alveolar artery, remaining within the mandibular canal to divide into the dental and alveolar branches. Excuse me. The mylohyoid artery arises from the inferior alveolar artery before the main artery enters the mandibular canal by way of the mandibular foramen. So you remember on the mandible, you had your ramus, and on the medial side of your ramus, you had the lingula and the mandibular foramen. And so the mandibular canal comes down from the mandibular foramen. It supplies the floor of the mouth and the mylohyoid muscle. Excuse me. So the inferior alveolar block has a high rate of positive aspiration with administration due to the nearness of the inferior alveolar artery to the nerve. So when you're looking at this picture, you're going to see the needle going straight back. The inferior alveolar artery and nerve run very close to each other. You are aiming to anesthetize the inferior alveolar nerve, but sometimes you can catch the artery as you're entering or exiting, and you will end up with a positive aspiration. In other words, if you draw back on the syringe, you hope to aspirate no blood. If you are in the artery, you will aspirate and you will draw back blood. The second part of the maxillary artery has the branches that are located near the muscle they supply. So these arteries are all accompanied branches of the mandibular nerve of the fifth cranial or trigeminal nerve. So the deep temporal artery supplies the temporalis muscle. The pterygoid artery supplies the lateral and medial pterygoid. The mesenteric supplies the masseter, and the buccal supplies the buccal mucosa passes to the buccal mucosa to supply the buccinator muscle. So they all sound like their name, or they all supply the areas that sound like their name. The third part are posterior superior alveolar artery. The dental branches of the PSA artery supply the pulp of the maxillary posterior teeth, the buccal periodontium and gingiva of the maxillary posterior teeth. So off of that branches the infraorbital artery, the anterior superior alveolar, and the descending palatine artery, the sphenopalatine artery, and the nasopalatine. So if you remember when we looked at the skulls last week, the posterior superior alveolar is going to numb and anesthetize the posterior teeth. So it's going to anesthetize these teeth. You've got your infraorbital, which is going to go infra or just below the orbit. Your anterior superior, anterior being in front and above, is going to come above your anterior teeth. Your descending palatine, the posterior hard palate. So think about where your greater palatine and lesser palatine foramen are, the posterior palate. And then you've got your sphenopalatine, which supplies the nasal area, and your nasopalatine, the anterior hard palate. Remember, we said the nasopalatine nerve and arteries are going to pass through the incisive foramen, so just behind your maxillary anterior teeth. This is a picture of your palatine arteries. And then this is kind of like one of those trees. This came right out of your textbook that shows the branches of the maxillary artery. It's a little bit confusing because the inferior alveolar artery actually comes off of the maxillary artery, but it supplies the mandibular teeth. So when in the arteries, the maxillary artery comes down and the inferior alveolar artery comes off of it. It supplies the mandibular. The nerves are different than that. A vein carries blood to the heart. So the valves and the veins are mostly absent in the head and neck area, unlike the rest of the body. This leads to a two-way flow dictated by local pressure changes, which is the reason that facial or dental infections can lead to serious complications rather quickly. So in other words, there's nothing to stop the flow, and so dental infection can travel pretty freely. Smaller veins or venules drain the capillaries of the tissue area. They coalesce to become larger veins. So remember, the arteries are like the tree trunk and they branch into the branches. The veins are like the opposite. They start with these little branches and they come down and they form back into the trunk. Veins of the neck start as small venules and become larger as they near the base of the neck on their way to the heart. They are usually symmetrical but have greater variability in location than arteries. Larger and more numerous than arteries in the same tissue area, so there are more veins and they are larger. The internal jugular vein drains the brain as well as most of the other tissues of the head and neck. The external jugular vein drains only small portions of extracranial tissue. So as far as arteries, The external artery supplied most of the head and neck. When it comes to veins, it's the internal jugular that drains most of the tissues of the head and neck. The facial vein drains into the internal jugular vein, anastomosis with other veins in the orbital region into the cavernous venous sinus. This is important because it can be the path for dental infection to spread, and it can be very fatal. It drains into the internal jugular vein into the cavernous venous sinus. It receives branches from the same areas of the face that are supplied by the facial artery, and anastomosis with deep veins such as the pterygoid plexus and the retromandibular vein before joining the internal jugular. So the cavernous venous sinus is important, the pterygoid plexus of veins, and the retromandibular veins, all draining into the internal jugular. The retromandibular vein emerges from the parotid gland, divides into the facial vein and the posterior auricular vein, forms the external jugular vein from a portion of its route, and drains areas similar to those supplied by the superficial temporal and maxillary arteries. The best thing I can tell you is, because we're going to kind of go back over this and trace it, but you're going to do this in your homework exercise, so this will help you a lot. But trace the veins back. Look at the pictures in your book, look at the PowerPoint, and look at the homework exercise and trace the veins. The superficial temporal, temporal vein is up here. It drains this lateral scalp, so the side of the scalp. It is superficially located, so it's close to the surface of the skin. And it drains into and forms the retromandibular vein along with the deeper maxillary vein. The maxillary vein is deeper than the superficial temporal, so superficial temporal is along the surface of the skin. The maxillary is deeper, so not visible. It begins within the infratemporal fossa. It collects blood from the pterygoid plexus. And after collecting blood from these veins, it merges within the superficial temporal vein to drain and form the retromandibular vein. The pterygoid plexus of veins is a small collection of vessels located around the pterygoid muscles. So you remember where the lateral and pterygoid muscles attach to the lateral and medial pterygoid plates. So this plexus anastomoses with both the facial and retromandibular veins. So in other words, they all come together. It protects the maxillary artery from being compressed during mastication. So when those muscles are moving to chew, it protects the maxillary artery from being compressed in that chewing action. And during improper needle insertion, during the PSA injection, you can spread infection. So when you are doing a PSA, you're angling your needle up and back into that area. We're not going to go as deep as that pterygoid plexus. That's why it's important we don't go that deep with the needle. If we were to go in too deep, we could be in that pterygoid plexus of veins, causing a hematoma. Posterior superior alveolar vein, the dental branches of the PSA vein drain the pulp tissue of the maxillary teeth, and the alveolar branches drain the periodontium of the maxillary teeth, including the gingiva. The inferior alveolar vein forms from the merging of its dental, alveolar, and mental branches in the mandible, drains into the pterygoid plexus. Dental branches of the vein drain the pulp tissue of the mandibular teeth. So remember, inferior alveolar, mandible, inferior alveolar nerve we talked a lot about when we talked about the mandible. Inferior alveolar arteries, veins, innervate the lower and supply the lower teeth. Venous sinuses, located in the dura mater of the brain. These dural sinuses are channels by which blood is conveyed from the cerebral veins to the veins of the neck. The venous sinus that is most important to dental professionals is the cavernous venous sinus. It's located on each side of the sphenoid bone, communicates with the pterygoid plexus, may be involved in the spread of dental infections. Internal jugular drains most of the tissues of the head and neck. Unlike many veins in other parts of the body, it does not have one-way valves. In other words, it can flow freely back and forth. Not having valves can lead to the backflow of blood, increasing likelihood of infection. Originates in the cranial cavity and leaves through the jugular foramen. So you remember where the jugular foramen was located, kind of off to the sides, lateral from the foramen magnum. The external jugular vein, the retromandibular vein, becomes the external jugular vein. It is the only vein in the head and neck region that has valves near its entry into the subclavian vein. There may be one or two anterior jugular veins. 2 is the most common. Pathways to the heart. On each side of the body, the external jugular vein joins the subclavian vein from the arm. Then the internal jugular vein merges with the subclavian vein to form the brachiocephalic vein. And now they've gone from all the little branches backward to the main vein. Because the superior vena cava is on the right side of the heart, the brachiocephalic veins are asymmetrical. The right side is short and vertical, the left is long and horizontal. And then there's some different terms for vascular lesions. You've probably heard of all of these. These terms are in your study thing of terms. Please know them. And last but not least, studies now show a link between periodontal disease and cardiovascular disease. There are 2 major theories on this link. One is that oral bacteria can affect the heart when they enter the bloodstream by attaching to fatty plaques in the coronary arteries, contributing to clot formation. And the other is that inflammation caused by periodontal disease increases plaque buildup, which may contribute to swelling of the arteries. So one is saying that plaque builds up on the side of the arteries. The bacteria is carried on the plaque and builds up on the sides of the arteries. The other says that the irritation can cause swelling of the arteries and narrows the passageway for blood. The bottom line is people with periodontal disease are twice as likely to suffer from cardiovascular disease than those without periodontal disease. So that's chapter 6 in a nutshell. I know it's a lot of information. I think if you kind of go back through and look at some of these study materials, we can, if we need to, we can put together a Teams meeting and discuss some of these things. I don't want you to panic. I want you to first start by reading the chapter, looking at all of the pictures, and look at the spreadsheet chart that I created for you. Know that you're going to have to come up with some mnemonics to memorize some of this stuff, but think of it as it starts out on the arteries start out as the tree trunk and branch outward. Veins start out as the little branches and come back down to the trunk. We will continue to discuss this further. Just for now, kind of get started on looking at all the material and start soaking it all up.